Hey, future nurses! Professor Angoma here, and let's be real, the NCLEX is a beast. But don't worry, we've got your back at Kingdom Healthcare. One of the key areas you'll definitely be tested on is health promotion and maintenance, which is all about keeping your patients healthy and preventing problems before they even start. We'll break down the must-know concepts and give you practical tips to rock this section of the exam. We're talking about the kind of info that will not only get you those passing scores but also make you a better, more confident nurse. So grab your study buddies, your highlighters, and let's dive in. Because when you succeed, you don't just become a nurse, you become a beacon of hope and healing. Let's get you there. Alright, let's talk about growth and development. This is where your nursing knowledge meets your inner child psychologist. Understanding the nuances of each developmental stage is crucial. You'll need to know the milestones, the challenges, and what's considered normal at each stage of life. From physical growth to cognitive and emotional development, every aspect matters. Picture this. A frantic parent rushes into the ER with a toddler who just took a tumble. It's a common scenario that requires quick thinking and a calm demeanor. As a nurse, you need to assess not only the immediate injury but also if the child's development is on track. Are they hitting their milestones? Are there any red flags? Is their balance and coordination where it should be for their age? These are critical questions that guide your assessment. This is where understanding growth and development becomes absolutely crucial. It helps you provide the best care and guidance to both the child and their parents. Now the NCLEX loves to throw curveballs, right? They test your knowledge in unexpected ways. They'll present you with scenarios and ask you to identify if a child is meeting those developmental milestones. It's about applying your knowledge in real-world situations. So, let's break it down, age by age, so you're more than prepared. Each stage has its own unique characteristics and challenges. First up, we have our precious infants, those adorable bundles of joy from newborn to 12 months old. This period is foundational for their future development. This stage is all about building trust. Infants rely on their caregivers for everything, and consistent, loving care is essential. Next, we move on to the toddlers, those little explorers from 1 to 3 years old. Their curiosity knows no bounds. They're all about asserting their independence. They want to do everything themselves, from eating with their hands to trying to put on their own shoes. It's a time of rapid learning and growth. Then come the preschoolers, those imaginative and energetic kids from 3 to 5 years old. Their world is expanding. They're all about play, making friends, and testing boundaries. Social skills and creativity flourish during this stage. Moving on to our school-age kids from 6 to 12 years old, this is a period of significant intellectual and social development. They're focused on achievements, both academic and social. They start to form their own identities and build lasting friendships. And finally, we reach the adolescent years from 12 to 18 years old. Teenagers. This stage is a roller coaster of changes. This is a time of massive physical, emotional, and social changes. They seek independence but still need guidance. Remember, these are just the highlights. Each child is unique and may develop at their own pace. Use your logic and reasoning skills. They'll come in handy on exam day. Trust your training and stay confident. Let's talk about prevention, the superhero of healthcare. It's the unsung hero that often doesn't get the spotlight it deserves, but its impact is monumental. This is where you get to be proactive, not just reactive. Instead of waiting for problems to arise, you take steps to avoid them altogether. It's about empowering your patients to take charge of their health and prevent illness before it even has a chance to take hold. By educating them, you're giving them the tools they need to lead healthier lives. Think of it like this. You wouldn't wait for your car engine to seize up before you change the oil, right? Regular maintenance keeps everything running smoothly. Preventive care is like giving your patients regular tune-ups to keep their bodies running smoothly. Regular checkups and screenings are essential to catch potential issues early. Now, when we talk about preventive care, 3 big things come to mind: screenings, immunizations, and assessing risk factors. These are the pillars of a proactive healthcare approach. First up, we have screenings. These are crucial tests that look for diseases before you even have symptoms, allowing for early intervention. These are tests that look for diseases before you even have symptoms. Think mammograms, colonoscopies, blood pressure checks. These are all about catching things early when they're easier to treat. Think mammograms, colonoscopies, blood pressure checks. These are all about catching things early when they're easier to treat. Early detection can make a significant difference in outcomes. Next, we have immunizations, those incredible shots that protect us from some pretty nasty diseases. Vaccines are a cornerstone of preventive care. Vaccines work by introducing a weakened or inactive form of the virus into your body, which triggers your immune system to build up defenses against the real deal. This process helps your body recognize and fight off the actual infection if you encounter it. Immunizations are one of the greatest public health achievements in history, and as a nurse, you'll be on the front lines of educating patients about their importance. Your role in promoting vaccinations is vital in preventing outbreaks and protecting communities. And finally, we have risk factor assessments. This is where we play detective and look for clues that might increase a person's chances of developing certain diseases. By identifying these risk factors, we can tailor preventive strategies to each individual. It's about identifying those red flags early on, so we can intervene and hopefully prevent a heart attack or stroke down the road. Early intervention can save lives and improve quality of life. Remember, prevention is always better than cure. By focusing on preventive care, we can reduce the burden of disease and improve overall health outcomes. By staying up to date on the latest screening guidelines, promoting immunizations, and helping patients understand their risk factors, you'll be a true champion of health and well-being. Your efforts in preventive care can lead to healthier, longer lives for your patients. Okay, future nurses, let's talk about one of the most beautiful and demanding areas of nursing, prenatal, and postpartum care. We're talking about supporting mothers and their babies throughout pregnancy, childbirth, and beyond. It's an incredible journey. And as a nurse, you'll play a vital role in ensuring the health and well-being of both mom and baby every step of the way. Let's start with prenatal care, which begins the moment a woman finds out she's expecting. This is all about monitoring the pregnancy, identifying any potential risks, and educating moms to be about everything from nutrition to labor and delivery. You'll be there to answer questions, address concerns, and provide that much-needed emotional support as your patients navigate the physical and emotional roller coaster of pregnancy. Now, prenatal care is all about those regular checkups. We're talking blood pressure monitoring, weight checks, listening to the baby's heartbeat, all those things that help us make sure everything is progressing as it should. But it's not just about the physical stuff, it's also about addressing the emotional and mental well-being of expectant mothers. Now, once that little bundle of joy arrives, we transition to postpartum care. This is where we focus on helping moms recover from childbirth and adjust to their new role as parents. We're talking about everything from breastfeeding support to monitoring for postpartum depression. And let's not forget about the newborn babies. Postpartum care also involves monitoring their growth and development, providing immunizations, and educating parents about safe sleep practices, feeding schedules, and all those other things that come with caring for a tiny human. Remember, prenatal and postpartum care is a team effort. Alright, let's talk about lifestyle choices, because here's the thing, our everyday habits have a huge impact on our health. The small decisions we make each day can either build us up or break us down over time. We're talking about the food we eat, how much we move our bodies, whether we smoke or drink, and how well we manage stress. Each of these factors plays a crucial role in our overall well-being. These choices add up over time, influencing our risk for chronic diseases like heart disease, diabetes, and even some types of cancer. It's a cumulative effect that can either work in our favor or against us. Think of it like this. Every decision we make is like depositing either a health coin or a risk coin into our body's bank account. Each healthy choice adds to our reserves, while each poor choice depletes them. Over time, those deposits add up. The more health coins we accumulate, the better our chances of living a long, healthy life. The good news is, we have the power to change our balance at any time. It's never too late to start making healthier choices. So how do we guide our patients towards making those healthy deposits? It's about empowering them with knowledge and supporting them as they make positive changes. Education and encouragement are key. First up, we have nutrition. A balanced diet is the cornerstone of good health. We all know that eating a balanced diet is crucial for good health, but it's not always easy to put into practice. Many people struggle with making the right food choices. That's where you come in, as a coach and a cheerleader. Your support can make a world of difference. Imagine you're talking to a patient who's struggling with their weight. They may feel overwhelmed and unsure where to start. Instead of launching into a lecture about calories and fat grams, you take a more compassionate approach. You listen to their concerns and understand their unique challenges. You ask them about their food preferences, their challenges, and their goals. This helps in creating a personalized plan. Then, you work together to create a realistic and sustainable meal plan that emphasizes whole foods, fruits, vegetables, and lean protein. Next, we have exercise. Physical activity is another critical component of a healthy lifestyle. Now I know what you're thinking, not everyone loves hitting the gym, and that's okay. Exercise should be enjoyable, not a chore. The key is to find activities that your patients enjoy and will actually stick with. Consistency is more important than intensity. Maybe it's dancing, swimming, hiking, or simply taking a brisk walk in the park. The options are endless. The goal is to get moving for at least 30 minutes most days of the week. Regular physical activity can significantly improve health. Encourage your patients to find a workout buddy or join a fitness class. Having that social support can make all the difference. It can turn exercise into a fun and social activity. Now let's talk about smoking cessation. Quitting smoking is one of the best things anyone can do for their health. We all know smoking is terrible for our health, but quitting can be incredibly challenging. The addiction is powerful, and the journey to quit is often difficult. That's why it's crucial to approach this conversation with empathy and understanding. Recognize the struggle and offer unwavering support. Imagine you have a patient who's been smoking for years and is finally ready to quit. This is a monumental decision that deserves celebration. You celebrate their decision and provide them with resources like nicotine replacement therapy, support groups, and counseling. These tools can significantly increase their chances of success. And finally, let's not forget about mental health awareness. Our mental and emotional well-being is just as important as our physical health. A healthy mind supports a healthy body. Encourage practices like mindfulness, meditation, and seeking professional help when needed. Supporting mental health is a vital part of overall wellness. That's it, future nurses. We've covered a lot of ground today, from growth and development to preventive care, prenatal and postpartum care, and the power of healthy lifestyle choices. Remember, the NCLEX is tough, but you are tougher. You've got the knowledge, the skills, and the compassion to ace this exam and become incredible nurses. Thank you for watching. We hope this guide helps you feel more confident in tackling the health promotion and maintenance section of the NCLEX. We're so proud of your dedication to this profession, and we can't wait to see you shine. Don't forget to like, subscribe, and hit the notification bell for more helpful content. And remember, at Kingdom Healthcare, we're always here to support you on your journey to becoming the best nurses you can be. Now go out there and make us proud.